It's time now for Business Spotlight, brought to you by Morris Hospital and Healthcare Centers. I'm Leanne Oliver, and today our guest is Dr. Lawton Moy. Dr. Moy is a board-certified pediatrician and internal medicine physician who sees patients at the Morris Hospital Ridge Road campus. Good morning, Dr. Moy.
Good morning, Leanne. Thanks for having me today.
Well, we're very happy that you're here today. This morning we're going to talk about something that most people really don't want to get, influenza, or short version, the flu.
Yes, influenza definitely is something that we can try to prevent, and we want to talk about why it's important today to get your annual flu vaccination.
Why should people take the flu seriously?
The flu definitely causes a lot of missed days at school and work, in addition to making people feel miserable for that 5 to 7 days when it happens. A lot of people have the high fevers, body aches, and felt literally like you got hit by a train.
True, I've had the flu at least 2 times in my life, and I wouldn't wish it on my worst enemy.
Right. In addition, it can definitely cause people with risk factors such as asthma, COPD, and diabetes to be in the hospital. And by getting flu vaccination, you decrease your risk of being in the hospital by 50%.
So 50% is one of the benefits to the flu vaccine. What are other benefits to people? Because I know that each year there's 1 or 2 variations of the vaccination.
So the importance of getting the flu vaccine every year is that the flu virus changes from year to year. For instance, this year's flu vaccine covers anywhere from 3 to 4 strains of flu virus, and for the 4th strain flu vaccine, it covers actually 2 new strains compared to last year's.
Oh, wow. So it's always mutating.
Correct, and we do our best to try to keep up with it.
Which is very difficult to do sometimes, isn't it?
Definitely. In given flu season, if they cover 50 to 75% of the flu strains going around, they consider that to be a success because they can't cover every strain. They have to predict what will be going around that season.
Who is at the high end? Who should get the flu shot?
So the higher risk people tend to be people that either are sick with weak immune systems, chronically ill, the elderly over age 65, and young children tend to be the highest risks.
What about if you've had the flu before? Should you always then get a flu shot each year?
Yes, it's recommended everyone over 6 months of age have an annual flu vaccine because like we talked about before, the flu virus changes every year, and by getting the vaccine in advance, you decrease your risk significantly of either visiting me in the doctor's office or, in more severe cases, being in the hospital.
Now, if you've had the flu shot, of course, as you said, the strains can mutate. Can you still get the flu if you've had the vaccination?
You still can get the flu if you had the vaccination, but the goal is hopefully that the flu you do contract will be less severe because your body's already seen how to fight against the virus and is prepared to do so.
What are some of the side effects of getting immunized with the flu shot?
The biggest side effect with the flu vaccine, like most vaccines, the local tiredness and soreness you have in your arm, which can typically go away with time. Some people getting a shot, because the way vaccines work is they rev up our immune system to prepare to fight against potential infections. And some people, when they get the shot, will have fever, achiness, and soreness, which is the same feeling you get when your body's fighting an infection.
Now, are the flu shots, I had a friend years ago who got a flu shot. She was allergic to eggs and didn't know she was. That's also a risk for some people, or are they doing different things with the flu shots now?
So when making the flu vaccine, there is a tiny amount of egg in the flu vaccine. Typically, most people with any egg sensitivities are able to obtain the flu vaccine. So for instance, if your reaction is just hives, then you can get your flu vaccine anywhere you like. If you have a more severe reaction like shortness of breath, throat swelling from egg exposure, then they encourage you to get that flu vaccine done in a hospital or clinic setting where if you need immediate medical assistance, that can be provided.
Now, Dr. Moy, if anyone wanted more information about the flu shots, how would they get in contact with you?
They're welcome to give me contact me at my office at the Morris Hospital Ridge Road campus, Minooka Healthcare Center.
Why should people get the flu shot?
prevention, like most things, makes things easier to treat. For instance, for your car, would you buy a car without an airbag?
No.
Okay. And frontal airbags decrease your risk of having a fatal accident by 30%. So if you get a flu vaccine, which reduces your risk of being in the hospital by 50%, why wouldn't you get a flu vaccine?
True.
Mm-hmm.
That's true.
Mm-hmm.
Good analogy. Anyone who needs a flu shot or would like more information about the flu vaccine should contact their primary care physician, or to make an appointment with Dr. Moy, he's available at Morris Hospital Ridge Road campus. They're located at 27240 West Saxony Drive in Shanahan, and his phone number is 815-467-1518. Thank you, Dr. Moy, for joining us this morning.
Thanks so much, Julianne, for having me on board, and hopefully everyone gets their flu shot.
Let's hope they do too. You've been listening to Business Spotlight, brought to you each Friday morning at this same time by Morris Hospital and Healthcare Centers. I'm Leanne Oliver. Have a great day, everyone.